Lower back pain is relatively very common, but do you know that there are symptoms, which means it is a referred pain from our internal organs, and these symptoms shouldn't be ignored. That's why in this video, I will teach you those 9 symptoms, and stay with me until the last one, because the last symptom, it is considered a medical emergency. Hi, this is again Doc Sherry, Doctor of Physical Therapy. Welcome to my channel. Back pain can sometimes be a referred pain from our internal organs such as our kidney and the prostate. Well, that is because our body is composed of network of nerves, and one body part can cause pain in the other parts of the body. These are the 9 symptoms of low back pain that you should never take for granted and that needs further evaluation. Low back pain together with stomach ache. If you feel lower back pain plus stomach ache, especially if you feel a pulsating sensation above your stomach, these can be symptoms of what we call as abdominal aortic aneurysm. This happens if the thin blood vessel wall in the abdominal aorta begins to swell. This affects the main blood supply of your stomach down to your legs. That's why it is very dangerous. And these symptoms shouldn't be taken lightly, especially for men over 60 years old and for those who have history of smoking. Low back pain plus fever means there is an ongoing infection. Now, this can either be an infection in the lungs, in the spine, or in the kidney. Some of these conditions would be Pott's disease, wherein it is actually tuberculosis of the spine, or possible infection in the kidney, for which case antibiotic is really needed for the patient to be well. Low back pain plus yellowish discoloration in the skin and in the eyes. These are symptoms of possible liver condition, especially when paired with early satiety. You easily get full even if you haven't eaten so much yet. You easily get tired, you feel bloated, and you notice changes in your nail beds wherein the nails become more white and you notice white or brown bonds known as nails of Terry. This is indicative of a liver condition. And if you feel these symptoms, it would be wise for you to visit any gastroenterologist near your place. A liver ultrasound is a very easy, non-invasive test that you can have to check presence of fatty liver and to check any possible liver conditions. If you have been diagnosed with non-alcoholic fatty liver disease, limiting excessive carbohydrates, limiting sugar, and also exercise, as well as vitamins such as phospholipids to help with liver health, it would greatly help you. Low back pain plus difficulty with urinating. This is especially true for men over 50 years old. If you are experiencing pain while urination coupled with low back pain, or even bleeding or blood during urination, please have yourself checked because these can be symptoms of possible prostate problem. If you have these symptoms, it would be wiser for you to check with a urologist near your place. Low back pain plus blood in the urine are symptoms of possible kidney stones. If you think you have kidney stones, please have yourself checked with a family doctor near your place. A simple urinalysis can actually check the presence of crystals and blood in the urine. And to actually prevent kidney stones, it is very important for you to avoid drinking excessive energy drinks and soft drinks, as well as limit your intake of salty foods. Hydration is king. Once your urine is clear, that means you are well hydrated. Low back pain plus vomiting. The type of low back pain that is actually triggered after you eat a fatty meal. These can be symptoms of gallbladder stone, especially when associated with nausea and vomiting. Low back pain plus bleeding or spotting. This is very important, especially for our postmenopausal women. If you experience back pain or hip pain together with spotting or bleeding after you had your menopause, it is wiser for you to check with an OBGYN near your place. This is also true for actively menstruating women. If you experience spotting or bleeding in between your menstrual cycle, together with low back pain, please don't hesitate to check with your OB/GYN because these can mean conditions in the female reproductive system. Low back pain plus weight loss. If you experience low back pain plus you notice that you have lost weight without an effort on your end to do so, please have yourself checked. Now, what is significant? 10% body weight is significant. So, for instance, if you weigh 70 kilos and you lost 7 kilos without exercising or dieting, please have yourself evaluated. Especially if you experience the type of low back pain that gets worse at night, the type of pain that disrupts your sleep. This needs further evaluation because this can mean a systemic condition. Usually, if the cause of low back pain is musculoskeletal in nature, this improves with rest. Before we continue to the last symptom that is very important and that needs further evaluation since it is a medical emergency. At this point, if you have learned something from this video, please comment informed in the comment section below. If you haven't subscribed yet, please don't forget to click the subscribe and the bell button below so you will be notified with our weekly health videos. Low back pain plus loss of control in urinary and bowel movement. This is a medical emergency known as cauda equina syndrome. And this is very important, especially for those diagnosed with lumbar spondylosis or disc herniation. This is a medical emergency that usually needs immediate surgery to prevent paralysis. Also, have yourself checked if you have low back pain plus you encounter balance issues or you experience weakness in your lower leg and in your foot, because these are symptoms of nerve compression or possible spinal cord involvement. These are the symptoms associated with low back pain that needs further evaluation. Home remedies will not be enough. Please have yourself checked so that you will receive prompt and medical treatment. If you have reached the end of this video, please comment your age and the symptoms that you're feeling. That way, I would be able to help you more. If you want to know the proper use of hot or cold compress to help you with low back pain, we have a video here. Check on it. It will greatly help you. Thank you very much for watching. I will see you on our next video.